Welcome to Flip Your Script, the vodcast from the American College of Lifestyle Medicine that's all about clinicians redefining care through lifestyle medicine. My name is Dr. Padmaja Patel, and I'm the current president of the American College of Lifestyle Medicine. I'm board certified in internal medicine and lifestyle medicine. In just around 15 minutes, we will bring you 5 key takeaways from leading experts and practitioners who are using evidence-based lifestyle medicine to transform patient outcomes. From practical strategies to success stories, we focus on the how of lifestyle medicine to empower you to make an impact in your practice and beyond. In this episode, we are honored to be joined by the leaders of the ACLM's Lifestyle Medicine for Cancer member interest group. Sami Mansfield is an oncology, wellness, and exercise specialist with expertise in exercise oncology, lifestyle medicine, and cancer survivorship. With over 2 decades of experience, she has developed and implemented exercise and wellness programs for hospitals, healthcare organizations, pharmaceutical companies, and nonprofits. Dr. Nigel Brockton is a cancer epidemiologist with expertise in cancer prevention, molecular epidemiology, and lifestyle factors affecting cancer risk and progression. With over 2 decades of experience, he has led research programs investigating the genetic and environmental influences on cancer development and metastasis. Kerry St-Pierre is a licensed nutritionist and certified nutrition specialist with expertise in clinical nutrition, lifestyle medicine, and oncology nutrition. With over a decade of experience, she has developed personalized nutrition and lifestyle strategies to support individuals in optimizing their health. Welcome, everyone. How are you all doing today?
Great.
Fantastic.
Wonderful. Well, so awesome to have you all today join us. So let's start our conversation by exploring your path into lifestyle medicine. Could you briefly share how your journey began and what specifically attracted you to this field? And we can start with Nigel.
My journey actually began with a cancer diagnosis when I was 18 and then at 21. And I decided that was going to be my career path. I was going to be a marine biologist, but so it was a sort of just a diversion into cancer research, and my PhD was in sort of diet and colorectal cancer and genetic susceptibility. And yeah, here I am almost 30 years later.
Wow, what a powerful story. Yes. Kerry, do you want to go next?
Yeah, so I was really drawn to the 6-pillar framework because it felt like it was highly applicable to everyone that was coming into my office for nutrition counseling. It felt like there was this sort of inevitability that even if they were coming in for GI or cardiometabolic or something oncology related, that the conversation would always sort of turn to one of these other pillars. And then when I saw the framework of the model, I was like, oh, I have to be board certified in this so I can really be literate in these other pillars and how I'm shaping my conversations around these topics during my sessions.
Yeah, beautiful. Sami, what would you say?
I feel in a very similar, situation as Kerry, starting in exercise oncology, 2 decades plus ago, recognizing that without all of the other pillars, it was really hard for our individuals that were impacted by cancer, both patients, even our professionals, to really feel their best mentally and physically. And so I kept having those questions of, well, what about this component? And so I really wanted to learn that piece. And then as somebody, like, I love implementation. It's really my passion. I love that we have a pillar about the things kind of to avoid, because that's really such a great piece of behavior change. It's not adding more. It's also what can we reduce? And I think that the 6-pillar framework was just a very attractive idea for me as a professional, as the next phase of my career.
Wonderful. So, Nigel, let me ask you, what is the role of lifestyle medicine in cancer?
So there's really two areas that lifestyle medicine has a massive impact in cancer risk reduction and prevention and cancer survivorship. In cancer prevention or risk reduction, we have very strong evidence for factors like avoiding tobacco, being a healthy weight, being physically active, eating a healthy diet. So we can reduce the cancer burden by about 40% if everybody did those things. At the individual level, you can't eliminate the risk of cancer completely, but you can definitely reduce your risk by about 40%. In cancer survivorship, it's about tolerating your treatment, having better long-term outcomes, and improving overall health. And lifestyle medicine, not just the diet and physical activity components that AICR focus on, but that whole sort of holistic, the 6 pillars of lifestyle medicine, for which there is less cancer-specific evidence for the other pillars, such as sleep, stress management, social connection, risky habits. But in terms of overall health, they're very important.
Yeah, and can you elaborate on how complex is this relationship and what do you want a health professional to know?
So the relationship is kind of both very complex, but also quite simple. The research is very complex. As researchers, we agonize over the limitations of the evidence that we have for each outcome and each component. But we're in this sort of information ecosystem where we're competing with products and programs and people who are making claims about things for which there is no supporting evidence. So in order to steer people and patients and clinicians towards the most effective and reliable aspects, that's really our central message. And it's kind of the boring but reliable factors that I mentioned in the prevention setting, which are just as applicable in the cancer survivor setting. And again, those are really to help people get through their treatment, have the best overall health coming out of it, build resiliency. So yeah, and again, we have direct evidence for some of the more measurable components like diet and physical activity. It's more indirect with the more sort of holistic lifestyle factors such as stress management, but they all affect your experience of facing cancer.
Absolutely, absolutely. Kerry, nutrition has been highlighted as an important lifestyle pillar in cancer. What are some key strategies you see as important for implementing nutrition?
Yeah, it's a great question, and I want to sort of piggyback on something that Nigel started to talk about, this very complex relationship that cancer survivors have with the consumption of information that is out there. And so I think it's really critical that all of us in the lifestyle medicine space, in the lifestyle medicine and cancer space, are really focused on understanding what beliefs people are coming in to the setting with the encounter with, whether they're seeing Sami for something more exercise oncology focused or seeing me for something more nutrition focused, where they've been consuming their information, what beliefs they hold, and as it specifically relates to nutrition, what role has nutrition played previously in their life? Is there anything that we can learn from that part of the patient's story that we can help sort of build the new story, leveraging the research that Nigel and his team members are doing, and then making things more concise for them? Because there is research fatigue for a lot of patients. There's a lot of well-intentioned, well-meaning people in their life that are bombarding them with ideas. And so I think it's really supremely important to understand, is there a lot of tension in their life currently about this topic of eating? What I've seen from a lot of survivors is this this very complex relationship with food, and this loss of confidence in their body that can come after treatment. And that kind of runs parallel to a loss in confidence in their ability to make decisions about how to feed their bodies. And so, yeah, I think we have to be really conscientious about, how they're coming in to us, and finding this terra firma on which we can build something sustainable that reduces their food anxiety and get some symptom management, so we can maybe let the light in a little bit through the nutrition pillar, and then help sort of create some other shifts in the other pillars, because the pillars work really well, as we know, together.
Yes, very well said. Sami, exercise and physical activity has mounting science in risk reduction and survivorship. What do you want clinicians to know?
My favorite question of my career. I think that the evidence now, especially here in 2025, is indisputable that it's safe, it's effective, it changes how people feel. I think where we get stuck is we come from, healthcare conversations. We're so specific in what is the treatment plan for someone with colorectal cancer. And I think exercise often has that sort of thought process of, ooh, should there be an exercise plan for someone with colorectal cancer? And the answer is, well, it's the one that they will do and the one that they maybe can access. A lot of my work and a lot of obviously supports a lot of the work with ACLM is really thinking about lifestyle from an equity lens. And one of my attractions to exercise is it's really, we have a gym, we have a body, and therefore it can be free. But teaching people how to move really goes back to kind of the comment that Kerry made, is building confidence. And so one of the things I want to remind our, clinician colleagues and medical colleagues, even risk reduction through survivorship, we have guidelines that every adult, including those with cancer, on treatment with advanced cancer, should strive to meet the same exercise recommendations as every adult across the globe. But what's the barrier is, what do I do? How do I do it? And I think that as we build up the confidence that it doesn't have to look perfect, that there are so many different strategies that can improve quality of life, fatigue, maybe improve outcomes once the researchers can find those, more deep dive strategies. It's exactly what Nigel said. It's complex, but it's really very much very simple. And so through a lot of the work that we've done, it's how do we elevate the awareness of exercise? I kind of say that we currently have recommendations that are very top down, meaning it's 150 minutes of moderate physical activity / exercise per week. Then it's, make sure you include strength. Oh, and by the way, stay active. And I think if we flipped the script on that, reducing sedentary behavior and inactivity, then building up the strength. And then, hey, if you can walk or you can get in those other activities, great. But I think it's even flipping the script of how we recommend exercise can be very empowering and accessible. So now that we have recommendations, we have a foothold. We have science, we have a foothold. But the implementation really, to me, is where the excitement is. And part of it's just building knowledge and access.
Love that. Nigel, while it's often said the best way to survival strategy for cancer is prevention, you've highlighted that this really is risk reduction. Can you share more about the science of lifestyle in risk reduction?
So the distinction between risk reduction and cancer prevention is really whether you're talking about the population, where that is prevention, and at the individual, it's about risk reduction. Because if everybody adopted and followed the healthy recommendations of avoiding tobacco, healthy weight, physical activity, diet, got screened, reduced sun exposure, all of those things, we could reduce cancer burden by about 40%. At the individual level, all you can do is reduce your risk. And it's hard to communicate individual risk to people. So a few years ago, I wrote a piece using a bathtub as an analogy for cancer risk.
Mm.
So we are all born with a certain amount of water in our bathtub, and as we live our lives, we have this leaky faucet that fills up that bathtub. And the more healthy behaviors we have, we slow that leaking into the bathtub so it fills up less quickly. And the unhealthy ones, we turn that faucet on a bit and it starts filling up.
Mm.
And what you're trying to do is avoid your bathtub overflowing, which is, a sort of a vision of cancer that breaks out. But all of our bathtubs are slightly unstable. So at any point, they can be knocked and that water can flood out. So the idea of keeping your risk level, your water level as low as possible for as long as possible. And that kind of gets around these people that say, well, my grandmother smoked for 100 years and never got cancer. Well, yes, she was very lucky and her bathtub was pretty stable. But
Yes.
it's just how you get across this idea that, and also to get away from victim blaming. We see the stigma associated with lung cancer,
Yes.
and even obesity-related cancers and others, where you can live the perfect life and still get cancer.
Yes.
And even if you're a smoker who gets lung cancer, you can't actually say definitively that that person was diagnosed with cancer because they smoked. Increasing number of lung cancers are actually caused by or are in non-smokers.
Okay.
So we have to get away from this victim blaming, but also get across that people do have the ability to reduce their risk and have some agency in that.
Yes, I love that. Kerry, can you share where you feel that the nutrition pillar can be taken out of context in lifestyle medicine and what clinicians should know?
That's a great question. So I think it taken out of context could mean, if we're trying to pursue something perfect, this 100% perfect chemoprotective diet. And I think that can, perfection becomes the enemy of progress. And again,
Absolutely.
this kind of relates back to what I was saying is that we really have to have an understanding of what is happening with the person that we're working with, in terms of, what are they experiencing right now post-treatment. There can still be so many things that their taste changes, smell changes, just taste aversions that are still residual and lingering. And if we're trying to take this idea of a whole food, plant predominant diet and put it in front of them too soon, that can like really turn them away, not just from using nutrition as a tool in survivorship, but it can also kind of make lifestyle medicine as a whole feel very inaccessible because we have to fit into each pillar very neatly and like perfectly. So I think when we talk about things being taken out of context, it's like really trying to remember that, it's one foot in front of the other. We have guideposts. We have Nigel's research. I go turn back to it all the time. And so, we have really lovely, helpful tools that can guide us and help guide people towards better outcomes, even if it's not exactly the same linear pace for everyone that's in front of us.
Yes, yes, I like that. Progress and not the perfection. Yes. Sami, what strategies can you share about how clinicians can use lifestyle medicine for their patients within the limits of current healthcare environment?
As we know that is a sometimes large list. I think the biggest, so I think there's two sides of this. One, and we know this through the research with ACLM, is that practitioners who participate in these habits themselves, who have found successful strategies, again, to Kerry's point, even small, simple strategies are much more likely to feel confident talking to their patients, their colleagues about lifestyle and about the lifestyle medicine pillars in these different ways. So I always say we have to start with us. The most important patient in the room is ourselves. And so I think that we should really think about, be the change in that new way. So I think first and foremost, make sure that as a clinician, not only do you understand the pillars, but really think about maybe where you can really focus on engaging those pillars in those simple ways. We tend to go into those categories that we feel the most comfortable with. As an example, I've been exercising for 30 years in some form of a gym setting. So for me, it's a very comfortable space to start. Learning nutrition, talking about stress management, a little less comfortable. So I think as clinicians, we should really try to engage in some of those things as a newbie. Therefore, we are learning sort of those new strategies that our patients might be experiencing. So super great way to implement and improve your own well-being. On a simplistic note of recognizing we do not have time in healthcare to have these deep dive conversations, we really are excited in the Cancer MIG, the member interest group, to launch our toolkit last year, which actually, contrary to what people think about cancer, they think, oh, it's the treatment cancer, toolkit. It's not. We did risk reduction and survivorship, knowing that we want to partner with other members of lifestyle medicine and the broader community that is going to be seeing patients in those spectrums wondering, ooh, cancer diagnosis, what should I do? So this toolkit was designed to be very simplistic in how we not only teach behavior change, motivational interviewing, small, simple habit change. It really does create an opportunity that clinicians can just dip their toe in the water, just like the toolkit, into those conversations. And I go back to exactly what Kerry said. It just is progress. So just starting small, simple will really create that momentum that I think we all need. And our healthcare system is really desperately seeking, just at an overall system level.
Wow, great. I really enjoyed our conversation. I think your message offers hope and inspiration to everyone, but unfortunately we're out of time. So thank you, Nigel, Kerry, and Sami, for sharing your time and expertise today. And thank you to our audience for tuning into this episode of Flip Your Script. We hope today's conversation has inspired you with practical insights on how lifestyle medicine is shaping the future of patient care. If you enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected with us for more episodes featuring clinicians who are rewriting the script on health, one patient at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. Thank you.